Now we will discuss about acute localized low back pain. Acute localized low back pain is a very common condition globally. It has attracted significantly less scientific interest than chronic low back pain. Patient demographics in an emergency department population show an average of 43 years for the people presenting with acute low back pain, with the 55% being women. 57% report moderate pain, and despite the publication of multiple guidelines, treatment protocols remain highly physician dependent. Management of a low back pain. Medical treatment often presents the challenge of aligning the patient's individual risk profile with the harms and benefits of a certain medication groups. NSAIDs and acetaminophen are the most commonly prescribed first-line medications. Opiates are highly effective but have a potential for abuse. Central muscle relaxants and benzodiazepines have sedation side effects but are valuable option in acute low back pain as opposed to their contraindications for chronic pain conditions. Tricyclic antidepressants are not recommended for acute pain conditions. Non-surgical treatments. With regard to interventional non-surgical treatments, the preponderance of a practice guidelines related to low back pain focus on chronic low back pain, while epidural injections show some benefit in radicular pain. The evidence for their use in non-radicular pain is limited, although there is evidence for the effectiveness of injections in acute iliosacral joint pain. Overall, the literature focusing on injections and similar interventions for low back pain frequently has a methodological limitations. There is a paper published in 2013 on patients' physical activity and recovery from episode of a low back pain. Author examined the effect of a physical activity on a functional outcome in acute low back pain patients, matching self-reported as well as accelerometer measured activity with the Roland Morris Disability Questionnaire score at baseline and at 3 months. The only correlation between the activity level and outcome was between self-reported back to normal activity level and RMD improvement. Self-reported and measured activity were not independent predictors of RMD improvement, challenging the common recommendation that increased activity during an acute low back pain episode leads to better functional outcome. Then the next question is, who are at the risk of developing chronic pain? Identifying those patients with a higher likelihood of developing chronic low back pain is one of the key challenges in treating acute low back pain patients. Mehling et al. Have developed and validated an 18-item clinical decision rule questionnaire to help stratify risk of progressing from acute to chronic low back pain. They found that 38% of patients were at moderate risk and 15% at high risk for chronification. To address some shortcomings of this study, another sample validation is pending. Coming to the prognosis. The prognosis for acute non-radicular low back pain is favorable. A systemic review published in 2003 showed 58% average pain reduction as well as disability improvement at 1 month, with a return to work at 82%. However, 73% patients reported recurrence within 1 year.